Hey, 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 it's Dr. Kre. Come on in the room. Come on in the room. We're going to talk about chronic pain tonight and why your doctor is likely to not write your prescription. Come on in the room. So come on. When you get here, make sure to drop your name in the box and comments box so I can tell you hello and thank you for joining us. So, of course, we're going to get started at about 7:04 or so. Give people time to get here and find the page. Who is that here? Who's here? Who's here already? Hey. Welcome. It's Dr. Kre. Put your name in the comments box so I can see who's here. Let's see. Hey, Ray. Hey, Ray. Let's see. Okay. All right. Today we're going to talk about chronic pain medicine and why your primary care doctor may not be writing them as frequently as they had in the past. So we're going to give everybody about 3 minutes to get here. 3 minutes. Doug and Fresh, you're on. That's what it was, right? So we'll get 3 minutes. So tag a friend, tell someone to come on so they can hear about this. So it's going to save them some time going in there fussing at your primary care doctor when you hear that they've changed their rules or their recommendations. So, hey, welcome in the room. Come on in the room. Come on. Hey, how you doing? Hey, Aubrey. Hey, Miss Vaughn. I see you. Hey, Sharika. How are y'all? Come on in. Tag a friend. We're going to talk about 3 reasons why your primary care physician may not be writing your chronic pain medicines, as well as, oh, hey, David. You're just listening and not watching. Okay, cool. That's good, too. Thank you for joining, even while you're driving. I'm going to talk about 3 reasons why your primary care physician may no longer be writing your pain medicines like they did in the past. What time is it? No, you're fine. That's okay. So, thank you for coming. Today is Monday. Hope y'all had a good day today. We had a pretty good day at the office. It's pretty busy today, which I don't mind busy any day of the week. So, it is, what time is it? All right, it's 7:03. You know who I am. I am Dr. Kre. I'm a board-certified family medicine physician, and I specialize in what's important to you. Through my education, my practical tips, and my educational benefit, I help you become a better you. And we just want to make sure that you are the best you that you can be. So through this live, we're going to talk about it. Hey, Miss Banks. So number 1, we're going to talk about 3 reasons why your primary care doctor may not be writing your pain medicine. So number 1, right, the government. Number 1 reason is the government. So in the last few months, the government has made a lot of changes. Back in February, I was in a meeting, and in the middle of the meeting, it was the end of February, and a guy came in and was like, oh, just so you know, on March 3rd, we're making changes. They're making changes to the law. The government is now saying that primary care physicians really shouldn't be writing, of course, chronic pain medicine and anxiety medicine together. So you had to come up with some kind of rule. As to how you're going to get your patients who are already on that kind of regimen together, how we're going to get them to continue to get him. And then also they wanted us to start calculating what's called the morphine equivalent. So if you're taking like Norco 10, we need to see 4 times a day. You get a number, the morphine equivalent number. So if the number is less than 30, the person is low risk. If it's 30 to 60, then the risk is moderate. If they're over 60, if that number's over 60, then you have a high-risk patient and you probably need to be getting them to pain management. That means they're taking a lot of pain medicine multiple times a day. So the government has kind of been dictating dictating a lot of this. So when I talk about chronic pain medicines, I'm talking about Norco, Percocet, even Tylenol 3, Tylenol 4, Tramadol. All of those are included in it. Every one of those drug subsets has a morphine equivalent level. So before you guys come in office, your doctor is likely calculating that morphine equivalent and seeing which section you live in and deciding how they should continue your care. Should we continue with the plan that we own? Should we refer you to pain management so that they can maybe start morphine? A lot of primary care doctors do not actually write morphine. They make sure to just refer it on to pain management. So a lot of pain management doctors are getting a lot of business now because as of March, they started having us to do this calculation. So low risk, medium risk, high risk. And also, if you are on any pain medicines, you know that you can't write any refills on Norco, Percocet. Those are higher scheduled drugs, more control. So you cannot write any refills. So you only could get 30-day supply. So I write a 30-day supply, and I'll give you 2 other refills. That's the most that I can give you at one time of the Norco or the Percocet. That's morphine if you're on that. So you have to hold on to those other 2 prescriptions. You turn in your prescription one at a time. The next month you take it on the same day. The next month you should be typically using the same pharmacy. We do not want you going and using multiple pharmacies, because you should have signed a pain contract in the beginning of your visit when you started getting pain medicine with your primary care or whatever doctor you see, and it says, I'm going to only use Walgreens, I'm going to only use Fred's Pharmacy, whatever the pharmacy that you're going to use, and you have to kind of stick with it. So you can't shop around. You get those 3 prescriptions. If you lose those 2 prescriptions while you're on this one, no doctor is going to write you for them. They're going to say, hey, you had those 3 prescriptions. You lost them. That's on you. So a lot of times we get that, oh, I lost my prescriptions. Well, I can't write anything for you until those 3 months is up. So, and we're not calling the pharmacy to override. So when I give you your prescription, a lot of times the pharmacy have their own rules. Everybody got their own rules. So CVS and Walgreens have started this thing where they are now going to give like 7 days at a time. I'm still trying to learn that rule. Have anybody heard about that? The CVS and Walgreens are changing how they give their narcotics. I recently heard about that in the last couple of days, and I've gotten a few calls today. I think we did on people and the amount of pain medicine, why they're on this and why they're on that. So just know that it's an issue as far as at the doctor level and the pharmacy level, because the government is mandating this. They are counting every single controlled substance that we as doctors write. And if you write a certain amount, then you're considered a high-risk doctor. And you have to go down this whole other path. So no doctor wants to be considered high risk. So you get doctors doing things like writing, I'm only going to give you a max of 3 times a day. Anything over 3 times a day, you have to see pain management. Or they're going to just say, I'm not writing it at all. You know, so because it's so much of a risk. And I'm not going to lose my license for anybody just because you don't really want to see pain management. Hey, Keisha, how you doing? So that's the big thing. The big thing is that you're saying, hey, I don't want to go to pain management. That's too far. It's only 2 in the area and this, that, and the third. But the doctor that you're seeing, their license could be in jeopardy if you're on a buku of, you know, if you're on Norco 6 times a day and Percocet 3 times a day. That's a lot for a primary care doctor, and you really need to be transferred to pain management so you can get the best care. So I know that was a long synopsis, but I want you guys to know that the government is cracking down. Number 2, hey, Miss Coleman. Number 2, the second reason is the addiction potential. So you start off with Norco 5 and you're like, ooh, that I was taking that and that was getting me good and I was feeling good. And then a year later, you're like, okay, now it's not working as well as it did. where your body is learning and building a tolerance to it. So you end up having to take more and more and more. Hey, Belmika, take more and more and more and more and more to try and get that same level of pain control until you're like, okay, that's not working. Now I need you to take me from Norco to Percocet and from there to the next thing. And your body just builds up a tolerance. Also, a big thing that you may not know is that pain medicine, the biggest side effect of it is constipation. So a lot of patients, I tell them, if you're going to take pain medicine, you're going to take a Norco or a Percocet, go ahead on and take your stool softener right along with it, because it attaches to the immune receptors in the gut, slows your gut down, and then you get constipated. Nobody want to be constipated. You know, your bones not hurting, but then you got to go sit on the toilet and you can't go. You're still miserable. Yes, thank you, Ramika. Yes, some people do get a high feeling, so they continue to push that dose and push that dose and push that dose. So you're building. Number two is you end up getting tolerant. Tolerance and addiction are two different things. So tolerance is when I need just more and more and more to achieve the same level of pain management. But addiction is when I'm taking it and I'm feeling real good when I take it. So I need some more before my 4 hours or before my 6 hours or before my 8 hours. I just need some more because I like the way it made me feel. You know, people say, well, the only thing that'll make me go to sleep is Norco. We're not going to give you Norco to help you go to sleep. I'm not, at least. There's other things out there that we can try. And you, so number two, y'all put on there tolerance. Number two, second reason is tolerance versus addiction. So you're getting tolerant of it. And so the third reason is because opiate addiction is crazy right now in the United States. The United States is the #1 country in the world for writing chronic pain medications. Yes, let that settle. We are #1 in the world on writing pain management medicines. So, you know, everybody's just writing it. You go to the ER, they give you 5. You go here, they give you this. But there are other ways to deal with your pain. There's physical therapy, but there's a co-payment that comes with that. So you got to realize, okay, yes, I'm in pain, but hopefully you won't be in pain forever. Some people are going to have pain forever, but we got to figure out ways to do it in a multidisciplinary approach. Like, not just pain medicine. I know a lot of people that just want to take the pain medicine, but like, no, take these pain medicine. Let's do some aqua therapy. You know, take some pain medicine. Let's go to physical therapy. So let's talk about one thing that I don't think a lot of people realize is what is considered acute pain versus chronic pain. If you've had your pain for less than 3 months, that's less than 90 days. Somebody write this in the chat. If your pain has been there for less than 90 days, that is acute pain. If your pain has been there for more than 90 days, you, my friend, have chronic pain. And there's nothing wrong with having that diagnosis, but you just have to know that you have to be equipped. That right now in our country, it's volatile. I mean, there's so many overdoses. There's so many people overdosing it and on it, and because it causes your respiratory drive to decrease, so you're breathing a little bit more shallow. It makes you sleepy, makes you tired. So you have more people that are really dying from the overdose, but also dying from, I got in a car accident because I mixed my, liquor with my oxycodone. Not purposely. I wasn't trying to do that, but it ended up happening. So, y'all got to check out. I did an article for the Reader's Digest on pain. It talked about pain medications and how pain medicines and control medicines can interfere with your driving. So check the link. Check the link out. It's in the Reader's Digest, and you can search my name, and it should come up. Okay, thanks, Vermika. So you're talking about pain less than 90 pains acute. So acute pain, your primary care doctor all over. You're going to get your pain medicine. That's because you broke your leg, you broke your arm, you had a big old abscess, they had to open it, you had surgery. That's acute. But when you get into now I have pain because I have arthritis. I'm not a candidate. I'm not a candidate for ibuprofen. I'm not a candidate for Aleve. I'm not a candidate for those kind of medicines because it makes my stomach hurt, or because I had a bleeding ulcer in the past. I can't take it. So arthritis, the best treatment for arthritis is actually anti-inflammatories, the naproxen, the Aleve, all of that. But you can't tolerate it. So the next thing to do is go to the Tylenol, codeine. Then from there, go to Norco. From there, go to Percocet. From there, go to you in a cycle. But you can't help it because you can't tolerate the anti-inflammatories. So there are a lot of people on the medication because they cannot help it. But there are also a lot of people out there that abuse it. There are a lot of grandmamas that come in there and they get those prescriptions and they go right out there and sell those prescriptions, and that's their rent. That's their grocery money. So that's a reality that's out there. So when the doctor comes in and say, you have to be drug tested to make sure it's in your system, it's for a reason. We have to monitor where you're going to get it filled. If you're getting it filled by too many doctors, those are all things that we have to do because it's my license in jeopardy. And I tell them every day, I work too hard. I'm not losing my license because of anything remotely related to pain and chronic pain and anything like that. And so number one, we talked about being the government, making number two, addiction. And number three, we are the leading prescriber. So there is a opiate problem in America. So, I mean, there's so much access to it. So number three is because there's just an opiate epidemic of opiate dependence in America. So, which is sad because a lot of people are addicted to it. You're talking about white collar people, not the crackhead down the street or whatever. But these are people that you wouldn't think, that you wouldn't look at and say, oh yeah, they look like they on drugs, because they don't look, these people don't look like they're on drugs. So, and as a bonus, I love you, so I always give you a bonus. So just know that there is a very big warning if you're taking anxiety medicines with, chronic pain medicines. A lot of doctors won't write them together. I have a rule that if you're getting one from me, you have to go to pain management. If I'm taking care of your anxiety, you got to go to pain management. If, yes, soccer moms, exactly. If I am taking care of your pain, then you got to go to psychiatry. I'm not writing it because I need that extra disciplinary help, because they can say, well, hey, I know you got anxiety, but you need some therapy to go along with it, or you need this book, or you need this. You don't just need Xanax. And Xanax runs out of your system very, very, very fast. You do feel that euphoric feeling, and it's one of the easier ones to get addicted to. So imagine taking a Xanax along with a Norco, and you're going to be feeling quite good, or you're going to be knocked out. So that warning is in place because so many people overdose by taking these medicines together. They may not be intentionally overdosing, but that is a cause of overdose. Taking the narcotic or the pain medicine with your anxiety medicine, because it, like I said, it decreases your respiratory drive. You're not breathing as deeply, and you already got COPD, or you already got sleep apnea, and you take all that stuff and not wearing your machine. So you got to make sure that you're doing the right things. So the government is cracking down. I mean, I'm not writing near as much as I used to write. And I am referring patients more. Number two, addiction/tolerance is real, because once you own it, you end up having to get more and more and more and more and more. And then opiate dependence is the number one in our country. So I don't want to be a part of that situation. I don't want to be aiding in that. I don't want to be a what is it called? Enabler. That's the word I'm looking for. And be mindful that if you have pain medicine and you're taking anxiety medicine, try not to take those together. You're probably going to have to see some specialists with that. But a lot of primary care doctors are really just backing off. In our area, there was a practice that was affected by it, so you have to we're trying to balance things. And it's not because we don't want to. It's because they're tying our hands. And yes, now I don't want to because they've tied my hands and I don't want to lose my license. So please be mindful when you go to your doctor and they make these suggestions. Know that there is some kind of intent behind it. Your doctor may not be like me and they may not explain the why of it. A lot you may just get just because I said so. There's that out there. But know that it's real in them pain medicine streets out there. and people are selling them. They are selling them. They are selling them. They are selling them. So, and make sure that you don't do drugs while you're on it. If you're smoking weed with your pain medicine, your doctor's probably not going to give it to you. If you're smoking weed, doing Xanax and your pain medicine, your doctor's not going to give it. Yes, weed is, everybody drink, everybody's smoking weed or whatever because it's legal in parts. But that is a combination and a setup for disaster. So, yes, the black market is very, very bad. So I have this rule that now if you got, marijuana in your system and I'm trying to help you with your pain, then you already got your own pain medicine system going out there with this weed you're smoking. So how about you just let that be, one less prescription that I'm deemed against for writing. So Blue Cross is now... is there a place to figure out? Yeah, you can Google it. You can look online and search morphine Miller equivalent, morphine equivalent. It's MME is the name of it. I can't think of the second M at this point, but it's the MME, and then you can put in there and it says how much codeine, how many times a day you're taking, and then it'll give you the scale: low risk, medium risk, or high risk. So, what questions do you guys have? I know this wasn't a real interactive one, but I felt like with the CVS and Walgreens making all the changes that they have, been doctor's office back and back, that this was a much needed discussion. Any questions? What time is it? Oh, 7:22, so not bad. Any questions? Well, you know who I am. I'm Dr. Kre. I'm a board-certified family medicine physician, and I specialize in what's important to you. Through my teaching and my tips, I help you. He said the mail order keeps over there. Very well. Okay, cool. I help you live the best you that you can live, so you can live well, live long, and prosper. So when you know better, you can do better. So not knowing is no longer an excuse. So follow me on Instagram. Find me on Instagram at Dr. Kre, DOCTORKRE. Sure thing. Thank y'all for joining in. And next week, we'll talk about something a little bit funner, a little bit lighter. So let me know what y'all want to talk about. Okay. Thanks. Follow me on Instagram at Dr. Kre. That's DOCTORKRE. Love you.